and welcome. The purpose of this presentation is to familiarize you with the upcoming procedure day so that you know what to expect. At this time, you should already have an evaluation by a rehabilitation and spine specialist and are referred to have a spinal procedure for your pain. To ensure safe and appropriate readiness for the procedure, please follow the pre-procedure instructions. For most anticoagulant medications, including Plavix or Agranox, it is recommended that you should stop these medications for 7 days prior to the injection. However, check with your spine doctor or primary care physician if it is safe to hold these medications prior to your procedure, especially if you are taking these medications to prevent a stroke, heart attack, or blood clot. If you are on Coumadin or warfarin, please check with your primary care physician or cardiologist if it is safe to stop taking this medication for a few days prior to your injection, and if Lovenox injections are needed while Coumadin is stopped. Then coordinate your schedule with the anticoagulation or Coumadin clinic for holding Coumadin and, if needed, taking Lovenox. An INR blood test will need to be done 1 day prior to the procedure. 5 days prior to the procedure, stop all non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and Relifen. It is recommended for you to stop over-the-counter herbal and vitamin E supplements 7 days prior to the injection. For procedures with IV sedation, do not eat or drink 8 hours prior to the procedure, except very small sips of water for all routine medications. For non-sedated procedures, you may eat a light snack and drink water prior to the procedure. Take all routine medications on the day of procedure, except blood-thinning medications. Check with your primary care physician regarding how to take diabetes medications on the day of the procedure, especially if fasting. Your procedure may be canceled if your blood sugar or blood pressure is too high. Bring an adult to drive you home from the procedure. Please read carefully over the pre-procedure instructions provided to you. Your spine procedure may be in one of 2 locations: the Arquez Medical Offices at 1263 East Arquez Avenue in Sunnyvale in the Physical Medicine and Rehabilitation Department on the 1st floor, or the Outpatient Procedure Center, or OPPC, is located on the 2nd floor of the Medical Office Building at the Kaiser Santa Clara Homestead Medical Center in Department 240. Please make sure you arrive at the correct location. Check your appointment reminder the day before your procedure or call the Physical Medicine and Rehabilitation Department at 408-530-2900 if you are unsure of the location. At both locations, you will check in and soon be brought back to the patient waiting and recovery area. From the lobby area, you will be brought into the patient waiting and recovery room. You will remain in street clothes unless a neck procedure is being done, in which case you will be changed into a hospital gown. If possible, please wear loose-fitting clothing so it is easier for staff to expose the injection site. Vital signs will first be taken. Then, the physician will explain the basic steps that take place during the procedure and obtain consent and permission for it. The consent form is signed by the patient and gives the physician permission to perform the procedure listed on the form. Risks of the procedure will be mentioned, including bleeding, infection, allergies, spinal headache, nerve damage, paralysis, and increased pain and numbness. Risks are considered to be low. You will have a chance to have questions answered here. Please use the restroom prior to coming into the patient waiting and recovery room. If your procedure is at the Arquez facility, patients may be accompanied by an adult family member or friend to the patient waiting and recovery room. However, this individual will not accompany the patient into the procedure room. If your spine procedure is at the OPPC on the Homestead campus, your family member will not be allowed in the recovery area. Once ready, a medical assistant will lead you to the procedure suite. Here, you will find the physician, medical assistant, and radiology technician. At times, there may be other medical staff as well. You may be asked to empty your pockets and remove any belts, as these may interfere with the X-ray machine. You will also notice a large C-shaped device, known as a C-arm. This is a movable X-ray machine that we will use to guide our needles to the proper location. For most procedures, you will be asked to lie on the table on your stomach. As a safety check, we will verify your name, date of birth, and medical record number. You may be asked to adjust your position to maximize your comfort and obtain the best views for the X-ray and injection. Once on the table, you will feel a cold, wet solution on and around the injection site. This is used to clean and sterilize the skin to prevent infection. You will then feel sterile drapes placed around the injection site, and you may notice the X-ray machine moving overhead. Once the procedure is underway, it is important that you remain still throughout the duration of the procedure. Once the proper entry point is identified, your physician will tell you to anticipate a pinching and burning sensation. This is the local anesthetic being injected into the skin and upper layers of tissue. Afterwards, you may feel a pressure-like sensation as the needle is guided to the correct position. Please inform your doctor if you feel uncomfortable at any time during the procedure. Once the injection is complete, the medical assistant will clean the injection site with moist towels. A bandage will be placed over the site, and you will be asked to sit up on the edge of the procedure table. After your procedure, you will be escorted back to the patient waiting and recovery room by the medical assistant. You will be given a set of post-procedure instructions and a pain journal to log your progress over the next 4 weeks. After your injection, you may experience worsening back or leg pain. In a few patients, there may be transient weakness. When the local anesthetic wears off in a few hours, you may experience increased pain at the site of injection. This is not uncommon and should be treated with a local application of ice. If you are a diabetic, you may experience temporary increase in your blood sugars. It is recommended that you check your blood sugars regularly for at least 2 to 3 weeks post-injections and report any abnormal fluctuations to your primary care physician. Your doctor will reevaluate you before you are discharged and instruct you as to when you can resume the medications that you may have stopped prior to the injection. Because the use of local anesthetics, you should not operate any motor vehicle for at least 8 hours after the injection. Your driver should be available to take you home after the procedure. Please contact us if you notice persistent worsening pain, redness and/or swelling at the site of the injection, persistent fevers, chills, or oral temperature of 101 degrees or higher, progressing neurological deficits, weakness, gait instability, bowel or bladder incontinence, or if you have any questions. You should follow up with your referring physician through secure messaging, telephone, or office visit a few weeks after the injections to determine the efficacy of the procedure. This concludes the presentation for your spine procedure. Should you have any questions or concerns, please don't hesitate to contact us at 408-530-2900. Thank you.